All right. Okay, welcome to Medical Moms of NICU. I have the pleasure of introducing a friend of mine, beloved friend. I've known her for almost going on 5 years. 5 years.
Yeah.
Takesha Ford. She is a registered nurse and she has almost a decade, well, going on 11 years of medical experience, and she currently works at the skilled unit in Louisiana. But I have her on here because she has seen it all, and I'm going to allow her to introduce herself even more about her medical experience in the NICU unit, as well as personal experience that she's had with her son, Yahmaine, who is now in college. And she has another child that's in high school, so she's almost an empty nester. So congratulations. That's young Yahmaine. And so she's showing us her son. And I think you can see it. But thank you so much, sis, for joining us on this Zoom interview. Welcome. And you can go ahead and introduce yourself in more detail if you like.
Okay. Well, like she said, I'm Takesha Ford. I love nursing. I have worked for us in the NICU unit. It kind of tugs at your heart from the things that you see. I couldn't continue to stay there, especially when my kids were smaller at that point in time, because it weighs on you. It does. It weighs on you. You see a lot of different individual kids that are critical. You deal with the parents that are going through a lot of different situations, mentally and physical. I must say, for us, one of my experience that really, well, it's a couple that really stick out. One is, learning how to take care of a baby when they're born so early that the skin is transparent, and your fingertips, when you touch them, feels like sandpaper, so you can rip the skin off. We have to wear special gloves when they're that small, because you can't imagine like your fingertips being like sandpaper to someone else's skin.
Right.
But in that situation, sadly, some of them do live, but that individual did not. I have seen it to the point where organs on the opposite side, and parents trying to go through different things, different situations, surgeries. The baby's going through a lot, and still the quality of life when the doctor come in and speak with them, sometimes the quality of life won't be there. There'll be a vegetable, if we continue on this route, or trying to save them, oxygen depleted, things along those lines. Tanisha is something.
Right.
It's something.
Have you ever experienced, Takesha, like some good testimonies? Because I know, like, when we talk about NICU, which is neonatal intensive care unit, it can be kind of daunting to talk about. But have you seen any stories where, in a situation where you saw certain babies come through that journey successfully? It took some time, but did you see any type of good experiences while you were there?
When they were born, maybe a couple of months early, I have. You see great outcomes. Sadly, if they're born 3 to 4 months early, it really gets slim. And if they do make it, because a few have, but they pretty much in a wheelchair or bound or a geriatric chair, kind of reclining for the rest of their lives. So yes, I mean, especially the way how technology and medicine has came along so far. Even now, for us, I think one of the best things that I have ever seen is when a mother is able to touch their baby. being in the NICU, you know, I was told before I even got there, you know, that wasn't even possible. They kept everyone separate, but, you know, because of the germs and the high risk, and they didn't have the means of what they have now, even as far as having a baby, as far as being in the incubators, you know, being able to help sustain life and kind of mimic the womb to a certain extent, the comfort level. So it's amazing. Technology is amazing. So yes, we have seen some positive things, especially through that. And obviously, you know, my faith is in Christ. So, and He knows all and can do all. And when faith is there, yeah, it has been.
Right, right. And I love how you said, you know, technology has advanced because, as you know, with our son Jaleel, he's been through a lot, you know, and so I remember the time when, you know, he had a lot of breathing treatment. You know, he was on the oscillator and then went to the ventilator, then got on the little oxygen mask, and then he eventually got to room air. But it took a while because he was on so much equipment that I don't even remember physically holding him until like a week after he was born. So I'm just grateful that, you know, it's come to a place where moms can do kangaroo care. They can also do pumping if they're not able to breastfeed. So they make it where you're able to still be that mother in the medical unit. Yes. And that's a good thing. Now, I do want to give the audience a little bit of your story, even though it wasn't NICU specific, but you did have a scare with your oldest son, Yahmaine. Can you tell us a little bit about that experience?
Yes, well, little Yahmaine, at that point in time, we were stationed in Japan. He was 1. And all of a sudden, I felt the bed moving. He was having a seizure. Jumped up really quick and obviously couldn't stop him from seizing and ran to my neighbor. It got to the point where he was having static seizures where they would kind of constantly come. And they named him as idiopathic, not known why he was having them. But they would last a little bit under 10 minutes. We were medevac to Hawaii, and he, from spinal taps to being so drugged up that, you know, he saw tarantulas, different spiders, or he wasn't really mentally there and very lethargic. It was a challenge. After being in Hawaii for a couple of weeks, they kind of died down, stopped having them. They sent us back to Hawaii, and less than a week, they restarted back up. So, no, within that day, the following day, they restarted. So they sent us back to Hawaii, and at that point in time, we had orders to go to Virginia, where it was a bigger medical facility. God is good. I mean, he wound up being on Topamax for a little while, and he couldn't sweat. So if it was 110 degrees outside, his body temperature would get to that point. So we had to make sure we monitor him and give him ice pops to keep the temperature at a cool point, because his body couldn't sweat on that medication. All that took probably a total of 5 months or so. Obviously been on the medicine for 1.5 years, but of course the hospital stays and back and forth was probably about 5 months or so. But you realize even in those situations that there are blessings. Being able to interact and speak with other parents that are going through things that might not be on your level, could be even, you know, intense, a little bit more, but yet still the things that you get from them parents, and that you are able to give to each other the comfort and being able to pray and realize that, you know what, this is where I'm at right now, and trying to take the blessing out of the situation, you know?
Right. So your thoughts,
But
like,
now,
I know you went through a roller coaster ride of emotions, obviously. Do you
oh yeah,
any experiences where, like, because you were in the hospital or your son was in the hospital for a long period of time, how was the communication? Because I know, like, even now they have this special program, and you might be familiar with, it's called Child Life, which it documents, like, infants that are in the NICU. They take pictures and they do little arts and crafts to kind of keep track of their medical milestones. Did they have anything, like, because you were going through a lot of emotions, did they have any support groups available for you as a mom, as a parent? How did they deliver information?
not at that point in time, and especially that it wasn't my physician or his physician per se, because we were being medevac back and forth.
Mm-hmm.
I wound up being blessed to come across some nurses that actually helped take care of me at that point in time, because the husband had to go back to Japan.
Okay.
They were very supportive, because I wound up being hospitalized myself. I got to the point where I wasn't sleeping when eating, and I was pregnant with Makana, my baby, the youngest one at that point in time.
Mm-hmm.
I guess what they offered there for us at the Children's Hospital on that floor was having the nurses come. They would put little Yahmaine in a little car and take him to the little center where he can kind of play with some toys, because at that point in time they had an IV in his foot and thinking about putting one in his head. So it was a lot going on. And I guess to keep his mind from it, and it really didn't take my mind off of it too much. My comfort level came from just being able to speak with other parents, going to the kids center where the kids would play at, you know. But I think it was their main issue, or their main purpose, were to try to get the kids to feel still like they were kids. But it wasn't like it is now, you know, as far as with the pictures, the different milestones and documentations. I mean, if you didn't take the pictures, you really didn't have any pictures. And at that point in time, I wasn't taking anything. I was barely sustaining, just trying to focus on him. So when he was in the hospital at that point in time, it wasn't as far as detailed and documented as things are now. But with that came technology, you know?
Yeah, they have, like,
the iPhone.
The beads of courage. I know you're familiar with that, where they give a bead for each medical milestone for the child, and they have little programs at children's hospitals now, where it's kind of like a memory, you know, of a series of memories that you can put up on their walls and stuff like that. So it's come a long way, but I'm glad that you had some strong parents around you that were going through almost similar situations, or even worse situations, and y'all had each other in that moment. Did you have any care conferences? Like, I know with our son, we had a lot of care conferences about Jalil's care and what the plan of action would be. Did they come together, like, as a care team for Yahmaine, and kind of give you with updates, like, regularly, or did you have to kind of prompt?
Not regularly. It happened twice. That's when we got with the neurologist, and also far as the doctor for us in the hospital, that was dealing with the spine at that point in time too. No, not as detailed, because their thing was they were trying to figure it out, and they kept saying, you know, it's idiopathical. You know, maybe he'll grow out of it if he doesn't stop having them by the age. We were told if he doesn't stop having them by the age 5, or if it continue on even on this medication, that, you know, most likely he'll have this disorder for the rest of his life. He won't be able to drive. as far as get his driver's license because, he have a seizure disorder. But now, even with seizure disorders, some kids with different medications are still able now to function. So at that point in time when Yahmaine was going through it, I don't know, they gave it was kind of slim. So I was just praying that, this is just a short-term situation and that he gets through it and we don't have to worry about the long term.
Mm-hmm.
But, after being on the medicine, like I said, for about a year and a half or so, even while on the medication for that year or so, he did not have any breakthrough seizures at that point in time.
Awesome. That's awesome.
They just stopped.
So he was eventually able to get weaned off the medication that they had gave y'all.
Yes.
Discharge.
Yes.
Awesome. Well, talk about Yahmaine today. What is he up to after all this complex? How old is he?
I wish I could show you an older picture, but the older picture is on the phone.
Okay. It's okay.
Because he sent it to me. All the other stuff is just don't have it yet. Stuff is in storage. But far as little Yahmaine now is 18, a lacrosse player, a collegiate lacrosse player. He's attending SCAD University. He was able to drive. He don't have the car now, but he has a game today. He loves what he's doing. He's majoring in industrial design, and to him, without the pictures, he don't even really recall the situation that he went through. But it's a blessing to be able to sit with him, and he knows that he has a purpose. You're here for a reason. We're all here for a reason, but you have a story to tell. You know that God is amazing, and you are where you at because of him. So I tell him to use his gifts that he was given. Use your gifts.
There you go. Well, I am so glad and proud of Yahmaine, and I'm thankful for you. And thank you for sharing your story, your medical experience with this. I appreciate your time, and I'm looking forward to hearing more good things from you soon, Takesha Ford. Thank you for your time.
Thank you. Love you.